Remember, under the United Nations Charter, it says that every nation, every people will get the minimum of healthcare, right? And I've said for years, when they mean minimum, they mean minimum. This is part of the depopulation program. Anything that comes out of the United Nations is to do with population control and world government. It says this new health bill that they're putting out in England will abolish the English National Health Service. There's hardly anything left of it as it is. It says it amounts to the abolition of the English National Health Service as a universal and publicly accountable service, people in academics have warned. Professors Alison Pollock of Barts and the London School of Medicine and Dentistry argued at the BMJ that the bill means providers are free to charge for some elements of care that are currently national health services. In other words, if you aren't stinking rich now, you ain't going to get much of a service at all. Providers will have extraordinary discretionary powers to define entitlement to the National Health Service provision and charge patients, she wrote. So that's one of them. And then it goes on in another article here to say rationing of health services across Europe, the whole of Europe. You know, it's a wonderful, giant, you enjoy it, you won't be left behind and all that stuff, and it'll be so wonderful for you. They're bankrupt now, and now they're slashing their health services. They're going to ration it out. The cost of healthcare across Europe is rising faster than the government's ability to fund it. Utter rubbish, because you can fund everything else. According to a report by the Economist Intelligence Unit, it says the report shows that health costs are rising faster than funding, they say. Health spending will continue to rise due to inflation, but also because the governments realise better public health boosts economic growth. That's an oxymoron, isn't it? They're going to cut your health care, but they realise that better public health boosts economic growth. So countries with universal healthcare models, however, will be forced to ration care and consolidate healthcare facilities, the report predicts. That means into long private chains. That's where it's all to go, like chain stores, won't be chain hospitals. For the highest buck, and the poor die and all the rest of it, and the elderly will probably be given euthanasia. It predicts that GPs will become ever more important as gatekeepers to the wider health systems in European countries and as coordinators of treatment for patients with multiple long-term conditions. In other words, the general practitioners, you have to bribe them. That's how you got through in the Soviet countries. You have to bribe them to get anything done. And that's exactly what's coming down the pike.